Hello, everyone. I'm Bishop Megan Rohr, and I have with me a crew of knowledgeable people who know a lot about some of the things that are going on with COVID and ways that congregations can respond to them. Hafiza, will you start out by introducing yourself?
Sure. Good morning, everyone. My name is Hafiza Salehbhai. I'm with the Emergency Operations Center in San Francisco as the faith-based community liaison.
And good morning. My name is John McKnight. I'm with the San Francisco Interfaith Council, and I'd worked with Hafiza at the Emergency Operations Center for the last year, helping present on COVID to communities such as yours.
Welcome, everyone. And we are going to start off with a presentation. Hafiza, you're going to lead us off?
Sure.
Perfect.
Thank you, everyone. All right. Good morning, everyone, again. And thank you for inviting us here today, Bishop Rohr. Again, my name is Hafiza Salehbhai, and I am the liaison of the faith-based community for the Emergency Operations Center. And alongside with me is John McKnight, who is a board member of the San Francisco Interfaith Council. We will share this presentation with Bishop Rohr, so you don't need to worry about jotting everything down. But I just want to let everyone know that this presentation will be available to you after this presentation. So as many of you know, the state of California fully reopened on June 15th, marking the end of social distancing, capacity restrictions, and mask requirements in almost all settings for vaccinated Californians, indoors and outdoors. The end of mask mandate and social distancing has many people holding on to wearing a mask and even continuing to social distance at houses of worship until they feel a sense of safety. Many are also taking into consideration of those who have not yet gotten vaccinated and might feel vulnerable, including all children and high at-risk populations, such as our seniors. In San Francisco, the Safer Return Together order went into effect on June 15th and will continue until amended or rescinded by the San Francisco health officer. Along with issuing this new order, many of the orders and directives related to COVID-19, like the indoor worship, dining, and gathering directives, will no longer apply. However, some others, like school and youth programs, will continue. I will be using the San Francisco guidance as an example, but check with your local Department of Public Health for your county and city public guidances, specific guidances. So the San Francisco Health Order now lifts local capacity and physical distancing requirements. This means that your house of worship may return to full capacity and social distancing is no longer required. But we do encourage unvaccinated individuals to continue to do so. This also means that you may sing individually or with a choir without distancing and masking. Businesses are no longer required to prepare and post social distancing protocols, or in most instances, submit health and safety plans. Additionally, sector-specific guidances under local health directives no longer apply. However, if you plan on having Sunday school or other youth programs at your house of worship, there is still a directive applicable for that sector. And although specific sector directives no longer apply, you should have considerations for youth, seniors at risk at any situations that would put them at high risk of the virus. Finally, businesses such as your house of worship are still required to report COVID-19 outbreaks in your workplace. Please note that the San Francisco's health order is aligned with the state, so if your house of worship is outside of San Francisco, these changes may apply to your congregation as well, unless your county has set additional restrictions. So prior to June 15th reopening, there were multiple signages that were required to be posted at your house of worship. In San Francisco, there are currently only 2 required signages. I've linked them here, so you could print them directly from these links, but there's also a San Francisco Outreach Toolkit where you can find samples of these flyers and posters. And also check with your local county websites for signage requirements. So here's the one that is required, one of the required signages for San Francisco, and is available to print online. This one reminds individuals of COVID-19 prevention practices to reduce transmission, including getting vaccinated, staying at home if you're sick and talking to your doctor, wearing a mask for added protection, and maximizing fresh air. Another signage that is required to be posted is in employee break rooms or areas where employees can be encouraged to get vaccinated and informing them how to obtain additional information. So you want to protect your employees' health, and you could do that by encouraging them to get vaccinated. Vaccination remains the best way to protect yourself and others. Fully vaccinated staff with no symptoms do not need to quarantine if they are exposed to someone who tests positive for COVID-19. And have your staff stay at home if they feel sick. Ask your employees to check for any COVID-19 symptoms before reporting to work. Make sure that employees do not come to work sick. Additionally, if someone on your staff does test positive for COVID-19, you do not need to shut down your business or close your house of worship, but instead you should inform your staff and proceed with any cleaning and disinfecting of your facility. Also, if you have 3 or more employees that test positive in a 2-week period, contact your Department of Public Health. San Francisco is no longer requiring a health and safety plan, but Cal OSHA requires that all businesses, including houses of worship, have a safety plan. You do not need to post it publicly, but you do need to have a plan ready in the event an employee tests positive. There is a document online or a template on Cal OSHA's website that you may download and complete your health and safety plan from there. Also, San Francisco is following the state's guidance about face covering. So masks are not required for fully vaccinated individuals, except in the following settings where masks are required for everyone regardless of vaccination status. And that's on public transportation or in transportation hubs, indoors in K through 12 schools, childcare and other youth settings, and healthcare settings, at state and local correctional facilities and detention centers, and at homeless shelters, emergency shelters, and cooling centers. So if you plan on opening a shelter or a cooling center or any other type of emergency center at your house of worship, then masks will be required by all regardless of vaccination status. The face covering requirements for employees is based on Cal OSHA, and this was decided on June 17th. If you have employees that is vaccinated, face coverings are still required when they are working indoors at your house of worship. Employers have to make N95 respirators available to unvaccinated staff. And I want to note that although respirators are required to have available at workplaces, it is 100% for voluntary use. So if unvaccinated employees choose to wear any other type of face covering, they may choose to do so, but you as an employer must have some available for voluntary use. Also, employers must document the vaccination status for fully vaccinated employees if they do not wear face coverings, excuse me, if they do not wear face coverings indoors. So let's say you have offices and all employees want to unmask. So you as an employer are required to log the vaccination status of all those who are remaining unmasked to back you up in the event there is an outbreak. And of course, houses of worship may choose to require masks for all patrons and staff, regardless of vaccination status. The face covering requirements for attendees and congregants is that only unvaccinated attendees and congregants are required to wear a mask indoors. You can have your attendees self-attest that they are vaccinated. You can verify their vaccination status by looking at the proof of their vaccination card or even the actual CDC card that they received at the time of vaccination. Or you may just set a general standard where everyone is required to wear a mask regardless of their vaccination status. So here are a few key best practices to keep in mind when reopening. One would think that with many restrictions lifted, we would start to see normalcy. But even then, there's always a personal choice that one should take into consideration. There's always individual's health, the risk of the situation you're putting yourself in, and the health of the people you'll be in contact with afterwards. So be respectful of people who have not yet gotten vaccinated and that still might feel vulnerable. And even though masking and social distancing requirements are lifted, it is a good practice to wear a mask and maintain distance when you are with others who are from different households. You no longer need to create vaccinated and unvaccinated sections, but you may choose to create a social distancing section for those who do not feel comfortable sitting next to another household. This way, you're not singling anyone out, but giving them the option to maintain their distance. You should also ensure to set up and maximize your airflow and outside air. Ventilation is still the key to preventing COVID from building up in the air. And for many of you, that can be windows and air purifiers or whatever ventilation measure works best for your house of worship. There are currently no guidances that directly speak to cleaning requirements. However, keep in mind that the spread of this disease does not seem to come from fomites, but it does seem to come from airborne transmission from an infected person. So it is a good safety measure to continue cleaning between or after services and to follow basic practices to prevent transmission of the virus. So basic wipe down using some cleaning agent on high-touch surfaces is wise, but something as simple as soap and water will do the job just fine. And also, if you're not doing any back-to-back services, then wait a few days so the virus dies off. And finally, think about your congregation as a whole. Create a safe, equitable, comforting, and welcoming space for your staff and congregants. If you have children attending your service, be a role model for them by wearing a mask. But the best practice is to have everyone mask and treat everyone equitably and remind people that getting vaccinated is really a gift. So make sure to get vaccinated as soon as you can. So that's all I have for you today. We'll be happy to take any questions.
We have our first question is from Donna, and they're wondering what organization in Alameda County or for Livermore would be the best place for someone to contact to get their specific guidelines. But maybe this could be something that you could talk generally if someone wants to figure out where guidelines are from their area. What's the best way for them to look those up?
I would check with your county Department of Public Health website to see what their guidances are. They may even refer you to the state guidance for anything. So check with your local county website first.
One of the things that I've heard questions about quite often at different congregations that I've been at is about singing. There was a period of time when we thought singing might be the worst possible thing that people could do, but now that large percentages of people in some of our congregations are vaccinated, people are trying to think about when they should sing, how they should sing, should they have a choir that sings? What thoughts do you guys have about singing?
John, do you want to take this one?
Sure. Thank you, Hafiza. In terms of guidances, you are permitted to sing. You do not require any social distancing. You may sing your hearts out. You may have a choir. You may use wind instruments and all the things that once we were told not to use. Now, with that said, we go back to some of the principles Hafiza brought up. The idea that maybe not everybody feels comfortable being in an environment where they are connected to a lot of people and singing. You have to know your congregation. Talk with your congregation leaders, ask them. And many of you may have a sense. Many of the faith leaders we've talked to know very well what their congregation members feel comfortable with. So it's more about the comfort level of the people around you. Now, in terms of safety, an unvaccinated person, if they were COVID positive and infectious, would be spreading a lot of virus in the environment if they were singing. However, if the people around them are vaccinated, those people are not going to get seriously ill from COVID. But this goes back to, if you're sick, stay home. If you're unvaccinated, please remain masked. But otherwise, there's no particular issue with singing or in any other way raising your voice in worship.
That's really helpful. And as Lutherans, we like to add extra prayers just so that we can sing a little bit more. And so that's a lovely thing to know about. Mary has a question. What guidelines do you have concerning serving communion, or what kinds of best practices have you heard about from congregations in our area?
Let me go into that one. Different practices have different ways of doing communion. A standard practice of communion, which is to hand the host into someone's hand or into the mouth, all of this is permitted. But if you are thinking about reducing potential for transmission, as much, touching someone's mouth and then going to someone else's mouth would be not the best idea. If you can do a to the hand communion, that would be best. If you want to, for a while, maintain even something a little bit more safe, such as, I know Megan has practiced this, Bishop Moore has practiced having individual cups where the communion is brought from a cup. So you're handed an item and you're not touching something that goes to someone's mouth. We've seen a lot of different practices, though most of the practices where people are handing to the mouth or using a common touch item. In some of the practices, they use a spoon and they physically pour the spoon and the wine into someone's mouth, and that's part of the communion ceremony. We know that it should sound from a health perspective to be a little hazardous. However, I can tell you that in the last year, we never saw an outbreak tied to a church doing this practice. So perhaps it's not as dangerous as we would say. I would say, as much as possible, limit common touch items. So if I hand you something that is individually yours, that's a lot safer than touching you, than touching somebody else and touching somebody else. By the way, I did talk to one Catholic church. They had a number of people, not a large group, that really wanted to take communion to the mouth. The priest had to meet them afterwards. He did it separately so that it was a separate group from everybody else, and he cleanse his hand in between each distribution. This was during the height of COVID, and I appreciate them taking that care.
Yeah, I've heard of some spaces that are, some places have done intinction, which is when you dip the bread into the wine. A number of places have stopped doing that because of just any sort of germs that might be on your hands that might get into the wine by dipping. I think a number of people have been doing kind of common cup, and then also some people have been trying to distance. So instead of being in the line real close to each other, if they go up to get communion, to be distance. And other places, like if they have the individual packets, you can leave them on the chair before worship, and then people open them kind of on their own. So there are lots of different ways that people have done it. I appreciate your helping us think about like avoiding the things that have one person touching the same item in a row, particularly if that item's going to go in our mouth.
Thank you, by the way, for bringing that up. If you are going to do communion, think about flow paths. Ideally, you don't want people to bunch up in one area, maintaining some distancing. Let's agree on this. If you don't know the makeup of your congregation, or for some churches, we work with a number of houses of worship that have tourists because they're high profile locations, and maybe they bring people in who are from the community, from the street. They want to make sure that the environment is maintained safe. They also, and I know that Cindy just brought up about children, because we have children under 12 who cannot even get yet vaccinated. Some social distancing is still a very wise idea within our houses of worship. So during communion, can you direct rows one at a time? Can they have a flow path that doesn't have them cross paths with one another? And to limit the amount of buildup, say, at the altar, if you were still maintaining distancing at the between pews, I have seen members of the church go up, Eucharistic ministers, whatever you might refer to them as, and they gave the Eucharist on site as they moved through the empty pew, serving to the people standing in front of them. That way, the congregation never gets up and moves during communion. Rather, the communion is brought to them.
That's good theology, too, the idea that God comes to you. I like it. Do we have any additional thoughts about things that congregations should think about in terms of children and young adults who are not vaccinated, and any special protocols you think churches should be thinking about? I liked in your presentation, Hafiza, you said maybe just to encourage youth to always wear their masks. Everyone should wear their masks around the youth.
Yeah, definitely. And just to kind of give a timeline for when vaccinations will be available for children under 12, Pfizer did announce last month that they were testing 5 testing on 5 to 11-year-olds, and those test results are probably expected to come in any day now, and they should be approved. And those who are 5 through 11 should be eligible to get the vaccinations, hopefully by fall this year, so by September. And then the testing for those 6 months to 2-year-olds, I think that testing is happening now. So we probably won't see those results until later this year, which means that our vaccinations for the younger youths won't be available until early next year. So this still means that we still have a long way to go until our children will be vaccinated. So we still have to continue maintaining distance and wearing masks, at least when we're around children.
I would add, I believe Hafiza, we shared this the other week, that the Catholic Church, one in particular, had put a posting, but they were going to maintain their masking because of their youth. And I think that came from the leadership in that church. So this may be, again, a choice that you choose to make, where you decide that until everybody has the opportunity to become vaccinated, that you maintain an equitable protocol for everybody, so the children don't feel different or put out, where the adults are able to unmask, the children are still required to do it.
I know there's at least one congregation, I imagine there's more, where there are individuals who aren't able to get vaccinated, either because they're immune compromised or particular allergies that the science around the vaccine has said that it's good for them to maybe not get vaccinated yet, or maybe at all in the future. Would the recommendation for those congregations be similar, that they're kind of just trying to follow as many of the protocols as possible and stay masked? Or is there anything special you'd recommend for congregations that might have someone who is going through chemo or otherwise immune compromised?
I would say similar. I mean, if you want to go ahead and just maintain it and make it equitable for everyone, make it comfortable for them. So maintaining distance and keeping your mask on probably would be ideal, especially if you know that your congregation you do have attendees that are immunocompromised. So continuing that, having hand sanitizers at your houses of worship, at your entrances, and have them available at, like, just kind of distancing them out. So they are available for people to, sanitize their hands whenever they need to, and also maintain a social distancing section if that's something that you want to do. So not a vaccinated or unvaccinated, but a social distancing section, so that those who are unable to get vaccinated can still, feel comfortable and feel welcomed and feel still safe at the same time.
Do you all have any thoughts about bulletins or things that people should be thinking about in congregations if they have paper handouts? I know throughout this time, as we've learned more with science, thoughts about like what is touched and how often before service have varied in advice. And so I'm curious if you guys have thoughts about bulletins with what is currently known about COVID.
Let me stress that in the early parts of the pandemic, great concern was given to a lot of areas. We wanted to make sure that we limited the spread of that virus amongst the population. And over time, it really became clear that what we call fomites, basically, I breathe onto something, a surface, and that surface then I touch and bring up to my mouth or nose. By the way, not touching your mouth or nose, great idea to prevent any kind of illness. However, the concern around fomite or spread from a touch surface has really been greatly reduced. So I would say this: use bulletins. If it's important to you, use bulletins. There's no real concern about it. There's no guidance that prevents you from using it. And a bulletin's kind of a one-time use item, ideally. Maybe you don't collect them and use them from service to service. If you had back-to-back services, that would perhaps be a nice protocol to have in place. Bulletin's a one-time use. However, songbooks, we know that people are going to use songbooks. And if it's one service you hold on a Sunday and you don't hold it for another week, no issue at all. If you had back-to-back services, you could decide if your population, if your congregation feels concerned, if that does concern them, then maybe go to something you hand out. However, I would not call it an area for worry. Don't worry about your books. Use them. Go ahead and use them. Don't worry about soft cushions on seats. But if you did have back-to-back services, and I think we should go into this in a moment, let's talk a little bit about the cleaning that we could recommend, but please know there are no requirements in the guidances. Hafiza, you want to talk about cleaning?
Yeah, so just a quick reminder, cleaning, you can just keep it as simple as just soap and water. So you don't need to use those specialized formulas or sprays that are out there. Something just as simple as soap and water will do the job just fine. And again, if you don't have back-to-back services, then just wait a few days so the virus does dies off, and then go ahead and have someone go in and clean. At least you won't do like a deep cleaning of it, but just at least that the virus is probably gone now, and you could just do like a overall surface clean.
Are there any special recommendations for bathrooms, particularly because congregations tend to be spaces where we rent to different community groups? And so there might be various groups using the space at different times, or even if groups are in separate sections of a congregation, there might be a shared bathroom that people use. I've heard all kinds of different things about bathrooms throughout different stages of this pandemic. What are kind of current recommendations about shared bathroom spaces?
Again, it's not required for like cleaning after every use, but just clean the high touch surfaces like the doorknobs, the faucets, anything that's common touch surfaces. Go ahead and clean those. And again, it could be at the end of the day, but it's not required for after each use. And have hand sanitizers available when people are walking out. Just kind of reminding them, it's like, hey, after you wash your hands, maybe you could even just sanitize your hands, and have signs in the bathroom saying wash your hands, especially for employees who are walking around as well.
And I would just add to this idea of washing hands. Like many practices, maybe we're forgetting about it. It remains one of the best ways to keep ourselves from getting sick from anything. Personally, I'm terrified when I feel a little sick now because I worry if I've maybe picked up COVID, right? I don't know if any of you have felt sick in the last year, but just even after my shots, I just got nervous. I don't want to get sick right now, so I'm taking extra care. But with regards to the bathrooms, as in any space, ventilation is one of your great partners. If you can open up windows, add a ventilation source, an air purifier, just to move the air, because bathrooms tend to be small enclosed spaces in many of our houses of worship. So whatever you could do to add fresh air, that would reduce the amount of aerosol transmission. And if you really want to take it to the next level, limit the amount of people in a bathroom at a time and talk to people. Go when you need to. Please don't wait till the end when everybody's trying to go at one time. Use them in a way that doesn't create a lot of people in one space at one time. That's always a good practice as well.
And I spent regular time with you each week when you all did a presentation to some of the different faith leaders here in San Francisco. And on that call, I learned a couple of things that other spaces are trying, kind of in the, it can't hurt to be cleaner than possible, especially, no one's ever mad a bathroom is too clean. And I heard some ideas like just leaving like bleach wipes or cleaning wipes in the bathroom with a sign that said, on your way out, clean the common use surfaces in the doorknob with one of these wipes and toss it in the bin. And congregations were finding ways to kind of share the cleaning rather than adding responsibilities for one particular person or staff that are busy in other spaces. This new variant, what are there things that we need to know about this new variant?
The variant is definitely out there. So San Francisco does have the variant. The variant is there, but what we know is that it's really affecting those that are unvaccinated right now. From what we know, we don't know how many cases of Delta variant have been in San Francisco, but we do know that all the deaths that did occur in the month of May through June in San Francisco did come from those who are unvaccinated. So the key message right now to protect yourself from Delta variant is to get vaccinated. And John, if you can add any more to that.
I would just add the positive note. The very good news of the Delta variant is concerning many people, and it's because of the unvaccinated the people who've chosen to not get vaccinated and those who cannot. Those who cannot have to be a little extra careful, and we recognize that, which is one of the reasons we encourage you to give your congregations the option to maintain social distancing and maintain masking and other protocols for those who either have a feeling that they want to be more protected or need to be more protected. And we want everyone, of course, to be welcome to come into their house of worship. The good news around the Delta variant is the vaccine works, and that is really encouraging. We're continuing to watch worldwide for any breakout variant that would not be affected by the vaccine. That has not yet happened. The Delta variant, though seemingly more infectious, is still able to be addressed by the vaccine, and that is where the good news is. And of course, to what Hafiza just said, please encourage people to take the vaccine so they remain safe and they don't spread the virus in their community.
What thoughts do you have about the length of worship services? So Mary's asking, should we keep our services short, no longer than 45 minutes?
There's no longer any requirements for how long your services should be, but if you are having back-to-back services, then I would probably keep some time in between services, just so that, you do have the opportunity to just go ahead and clean any common touch areas. But there are currently no guidances on how long a service should be.
Masks. There's been different types of thoughts about which types of masks are the best. Different scientific studies about what kind of mask you should use and when. Do you have any sort of idea about which masks might be more helpful than others?
I don't have one here with me right now, but I mean, the cloth, any two-layered masks, those are always great. And by now I feel like everyone has plenty of those. I feel like I have one that kind of matches all of my wardrobe. So, those are always probably the best. The ones that are layered, they're saying the ones that are just single layered are probably not the best ones to wear, but if you can probably layer it up. So if you do wear one of the disposable ones and then cover it up with another layered one, that's probably perfectly fine as well.
Are there other things that you think we should know that we haven't asked questions for?
By the way, on the word of masks, it's like with plans. The best plan is the one you use. The best mask is the one you wear. Do please, if you're needing to wear a mask, if you're unvaccinated, or if you perhaps have children at home and you want to be very cautious about the virus, find a mask that's comfortable. It might take a little time, and use that one. There are a lot of people who ask about double masking, or do I wear an N95? And it gets a little bit. It's not necessary. It does not seem to make a significant difference unless you're in a hospital care setting and you have requirements for your masking based on that employer. Generally, a good cloth mask. It's amazing. I don't have one sitting right here, but there's a bunch of them in my closet, and mine's a simple cloth mask that we had made by a wonderful youth artist here in the city, and that worked for the entire last year. So I think it's probably a good fit. Things we want you to walk away with.
I did think of one more question before that.
Oh,
okay. And this is maybe letting folk know how very into the medical research you have been, John. But I still have some people who have wondered about the safety of the vaccine because of how it was developed, wondering if it was developed quickly. I'm wondering if you could talk about how the vaccine was created and some of the science behind it.
Thank you. And we have a whole presentation on that, which is
I
wonderful.
know.
So let me try to break this down in just a very short period of time. A little tragedy, the Operation Warp Speed concept, that phrase that was used to demonstrate that we were going to get a vaccine very quickly. I think it had the right idea. It sent the wrong message. It gave the impression that the vaccine was developed in a very short period of time, where in truth, we were all absolutely blessed that over the last decade and even longer, very significant work was done in two parallel directions. There was research done in the mRNA vaccine capability, and this was done by a particular group of researchers who I have a slide presentation about. And at the same time, there were three researchers who almost nobody had ever known existed. And they had developed a vaccine concept that was going to be used to address the MERS vaccine. If any of you remember that, the Middle East Respiratory Syndrome, it killed about 500,000 people. It was very serious. It didn't merely make it here to the US, but for a while there, they were concerned about how it was going to transmit. It was an epidemic, but not a pandemic. It didn't, mostly because it killed the people very quickly, and so it didn't spread across the world the way this one did. That was also a coronavirus. And these group of researchers, and this is over about the last 10 years, figured out how to create a vaccine to the MERS. But the World Health Organization decided that coronaviruses were not a big issue. Their papers never even got published. They got no attention, and they were moved to a small basement within their University of Pennsylvania research facility. And yet the people at the World Health Organization remembered their work, and when they realized that this new virus, the SARS-CoV-2, was a coronavirus, they called them up right away. They pulled their research out, and lo and behold, it was the key to creating a vaccine. The work these people had done, unsung heroes, was the foundation for the vaccine. But this is a sort of a long story to tell you that the work to create a vaccine had already been done. We were just genuinely blessed that it applied to the pandemic we're occurring at now. So the tools are in place. This is to say there was no rush in creating the vaccine. It was done over a very long period of time. And had these people not done this work, you're correct, we would have been 2 to 3 years away from probably having a vaccine. Instead, they had the components together. They merged 2 areas of research, the mRNA vaccine concept, along with this new means to create it is a mechanism to create a vaccine to this virus. And I could say a little more about that, but let me stop just to say these 2 areas of research came together very quickly because they already existed. Work was done at the National Institute of Health to create this vaccine using these 2 lines of research that were already proven, and they were able to roll this through into trials almost immediately. But it's just all added, it was not rushed. It was a result of tremendous hard work over years that people had done to address prior outbreaks of coronaviruses in our world. Let me stop there. And please, if there's any other questions on this, I'd be happy to do a deeper dive.
Yeah. So we got 2 more questions that have been added to our queue. Temperature checks. Should congregations still be doing temperature checks?
They're no longer required. You may choose to do so if that's what you feel comfortable with, but definitely not required anymore. People are, even health screening questions like, have you been tested positive? Those are not required anymore either. So as far as I know, the congregations in San Francisco, I do not believe that they are doing any temperature checks now.
Thank
Agreed.
you.
Those got pulled out from any requirements. Some people feel good about it, and in some ways it can also, if you're just doing even a health check as people come in, maybe it's a way to remind people of the importance, especially if you have a congregation that extends beyond, say, an immediate community that you know very well. If people are coming in from the outside, it might be a nice reminder. So putting in a health check, if you will, not just simply a temperature check, but a health check might be a good protocol. But I want to back up one moment. The person who asked about the shorter services, Mary, one consideration is the reason short services were suggested is they didn't want people in a space where they might be exposed to COVID for long periods of time. This is where if you can ventilate your space very well, it really makes that a lot safer. And if you know your population is vaccinated or vastly vaccinated, it really reduces down that need to shorten your service. So please feel encouraged to have a longer services as long as you're taking other protocols to make sure that the environment there, if you had a COVID positive person breathing, wouldn't be building up in that space. I hope that answers your question.
Yeah. And then I can't believe I forgot passing the peace. So passing the peace is a varied practice in different kinds of congregations. Originally started as kissing on the cheek or kissing on the mouth. We don't do that as much in Lutheran circles, but it could be a hug, a fist bump, shaking hands. Are there recommendations about passing the peace? And is that different for people who are vaccinated and unvaccinated? What are your thoughts?
let me say this. Let's imagine a room full of people unvaccinated, a room full of people who could be carrying the virus. Now, I don't know about you, but I touch my face all day long. I just do. Now, if I shake your hand, am I transmitting it? Now, it's on your hand, possibly. Are you doing the same thing? Are you touching your face? Are you bringing it up? Is it possible to share that through a hand? Possibly. This is where, if we're taking care to wash our hands, if we're taking care to not touch our face, you could really reduce down even the worst case options. There's not a tremendous amount of concern about sharing the virus through a handshake. And if your population is vaccinated largely and you're being careful to not touch everything around you, maybe this is not the biggest concern. I'm a long way of saying I think your handshaking and the rest is fine. The question more is, what are your congregation member people comfortable with? Do they feel comfortable shaking hands? Would someone feel comfortable if you gave them a hug? I think there was a church or a house of worship we spoke to that they are using little stickers. Megan, did you bring this up one time? Look, green, yellow, and red. Green, go ahead, hug me. Yellow, we can shake hands, and red, please stay away. But it has to be an individual choice, and you need to know the people around you. Maybe is it okay to shake hands? Sure, I think it's fine. Be conscious, wash your hands, sanitize you come in, sanitize you leave, be a little cautious, be cautious of touching your face if you're touching a lot of people at the same time. Think about those things. If you have little kids around you who are not vaccinated, little extra care. But more about, what is the person across from you comfortable with? This is a sharing a piece of peace, true mental peace. Maybe we need to maintain some level of distancing, have jazz hands, a prayer, peace, something else that lets people know you are wishing them a well-being of spirit without in some way compromising their feeling of safety.
I like that. Contact tracing. Are there some congregations have been not worshiping in person this whole time and are thinking about starting to come back together, and so haven't had to do contact tracing before? What kinds of information do you recommend that people have for worship participants, just in case they do need to contact people and let them know about an exposure?
Something as simple, just name and some kind of contact information, so either email or phone number. I think that those two are basically just the key in just in getting in contact with them in the event there is an outbreak or someone does test positive. Again, it's not required, but always good to have that log of attendees so that in the event there is an outbreak or a positive case, then you can go ahead and contact them.
Thank you. That's really helpful. Anything we didn't discuss that you think we should lift up for people or for their thinking or final thoughts? What do you guys think?
Hafiza, I want you to do the closing bit of this, but let me say to you all, Hafiza and I worked together at the COVID Command Center, and the piece that sometimes gets forgotten is the mental health stressors of this pandemic. We are focused on the virus and its physical effects on people, and sometimes we forget about the mental stress that the isolation created for so many. This is to say, we want you back in worship. Please find a way to get people together. Know your congregations, know what they're comfortable with. Create a safe space, both physically and emotionally. People have to feel safe as well as be safe in their house of worship, because we want them to return. It's essential that people find a place where their souls can be filled. And we encourage you to, contact Hafiza, contact us. Let's help you make sure that if you have any questions or concerns that are preventing you or limiting your ability to open, we can talk you through it. There are many churches that have opened safely, been open safely for a long time, and we can help make sure that you learn from them so that you can do this well and get people back to where they need to be. Hafiza.
Thank you, John. I think that's a great point. Ultimately, it's really your choice on how you want to make your congregations feel safe. So it kind of just boils down to their health, the surroundings you're in, who's in that situation. Do you have children, seniors, people are at high risk? So it's always a good idea just to keep in mind all the prevention measures in mind, ventilation, wearing a mask, and distancing whenever possible. So, yeah. So, and again, if you guys have any questions, please feel free to contact us.
Yeah, and so we'll be posting the information in Hafiza's slideshow from the beginning and contact information so that you can reach out to folk, and sharing an archive of this video so you can share it with your congregation and other faithful folk who you think might want to learn more about these issues. I'm so grateful that Hafiza and John could join us today, and for all of the work that you all have done to be listening to the concerns and the prayers and the hopes of interfaith congregations kind of throughout San Francisco. And I have, I think at many points in this pandemic, been grateful for your wisdom and your guidance and for helping to think through a lot of these issues. And just, if you haven't been thanked enough, 1,000 thank yous from me personally and from Lutherans in our area, because we couldn't be more grateful for the work of emergency managers and all who have done their best, even when what we know was less scientifically. And so know that I am grateful for you, and I'm keeping you in my hopes and well wishes and prayers. And I'm just so delighted that you could join us today. Thank you again.
Thank you for having us here.
All right. Take care, everybody.